My name is Dr. Cozy. It's really nice to meet you. You found our office okay? Okay, great. So, before we get started completely, I do have a few questions I need to ask, okay? First one being, is this your first time seeing a naturopath? Okay. Well, you might find it to be a bit different from your general practitioner, but also some things are going to be the same. One of the differences is that I don't treat symptomatically. Instead, I treat the body as a whole, because oftentimes, for example, if we're having inflammation, well, a general practitioner might tell you to use ibuprofen. I will look for the cause of that inflammation and will treat at the source. So, I also find a few different things that are different, such as we use more supplements, herbs, natural remedies when we can, than, say, big pharma. But that doesn't mean that there aren't generalized medications that have their use. So, okay. Can you tell me what brings you in today? And can you tell me how intense is that fatigue that you're experiencing? Is it just that you're crashing during the day, having a hard time getting out of bed? Are you finding yourself unable to perform your chores or tasks at work, or and how long have you been experiencing this? Can you tell me a little bit about your current diet, just on average? It doesn't have to be a precise day-to-day recounting. And do you take any medications or supplements? And how have you been sleeping? Are you having any difficulty waking up in the morning? Difficulty falling asleep? Do you feel like you wake up frequently during the night? Okay. How frequently do you exercise? Okay. And what types of exercise do you do? Okay. And do you feel like your body recovers okay from those workouts, or are you sore for a few days? Okay. Any recent weight gain or weight loss in the last few months? And was it on purpose, or? What is your current stress level? Your current stress level like? Are there things that you do to manage your stress? Do you feel like they help? Sometimes. recently nauseated or been vomiting or anything like that? Alright. And any kind of changes with your skin, with your hair, or anything that you've noticed? Okay, we'll take a look at that. Alright. Okay, well, that is all of my questions for now. So I'm going to start our actual exam. So I'm going to put on gloves here. And drop them on the floor. Scoop myself in front of you. Alright. So to start, I'm going to be examining your face, the skin, your eyes, mouth, okay? Then I'll move on to your scalp and we'll take a look at that redness that you've noted, okay? Okay. Is it okay with you if I touch you? To start, I'm just going to look at the color and I'm going to press and see how long it takes for the skin to come back up. Okay. I'm going to take a look at your eyes. Just gently pull down your lids, okay? Can you look up for me? And then look right. And look left. Okay. And I'm going to pull your lids up, okay? Look down. Okay. Keep your eyes open as best as you can. open your mouth, okay? Thank you. And just lift up your tongue for me. And stick your tongue out. Okay. So then I'm going to stand up and take a look at your scalp, okay? As well as your hair. The actual hair itself looks good. Cuticles look healthy. Couple split ends, but that's normal. Take a look at your scalp here, okay? Do you have any pain in your scalp? It does look a bit dry here. How hydrated do you tend to keep yourself on average? Okay. Sometimes dehydration can contribute to some irritation, dryness, and flaking of the scalp. It's not always the cause. now I'm going to feel around and see if I can find any kind of lymph node inflammation, lymphadenopathy. Feeling in the back, the occipital area. There are a few nodes back here, just consistent with your scalp. I'm going to feel around your shoulders. Elbows. Wrists. Knees. And ankle. Can you hold out your hands like this for me? Okay, and then turn them over. Hands look good, fingernails look good. So now I'm going to listen to your chest. Can I get you to take a deep breath in for me? Good. And out. Okay. And again, deep breath in. And out. Again. And again. Okay. And I'm just going to listen to the arteries in your neck. And your tummy. Okay. Everything did sound okay there. Now, just going to feel and kind of press around your abdomen. Let me know if any areas cause you any discomfort, okay? I do feel a little bit of inflammation around your liver. And a little bit of abdominal distension, probably due to bloating. Like I said, I did feel some inflammation around your liver and a little bit of distension in this abdomen, right? So, oftentimes, liver inflammation can be caused on stress on the body. Normally, the culprit is we have consistently high cortisol due to just life stressors, not sleeping well. It can definitely build up over time, and it's really common, so don't feel alone, okay? We have means that we can address this. So in terms of liver health, I do like to start with identifying the stressors in your life and learning different skills to practice when you feel like your stress levels are elevating. Because when our stress, our cortisol is high, it's difficult to sleep. Cortisol is a stress hormone. It's actually what allows us to wake up from our sleep every day. So we do need it, but that's also can be a double-edged sword, because when the stress levels are too high, it can also prevent you from falling asleep or staying asleep. And disrupted sleep patterns can contribute to a whole slew of different ways of presenting in the body. So I am going to do an energy scan with you and see if we can't sort of identify anything else going on. Any other areas of tension that might be contributing or inflammation. However, first I want to do some breath work with you. Something called Pranayama, okay? And this is a common practice that goes along with yoga, but you can also use it with meditation and also to help yourself relax. What we're going to do is breathe in slowly, hold it, and then exhale even slower. So, first let's take a deep breath in, and we're going to empty all of the air in our lungs. And breathe out hard. Good. Now we're going to inhale very slowly on a count of 4. So, 1. Hold. And exhale even slower for 1, 2, 3. Should feel a little bit more relaxed, yeah? Okay, we're going to do it again. So, exhale everything you just took back in, out. And inhale. Hold. Slow exhale. Take some practice, yeah. Okay, we're going to do that one last time, alright? So, inhale. And how do you feel? More relaxed? That is the goal, and it's usually very effective. Okay, so now I'm going to be scanning your body, just using my hands, hovering over. You might feel a little bit of a tingling sensation where my hand is hovering, and that's okay. If you start feeling anything uncomfortable, if you have any intrusive thoughts, or just a feeling of irritation, restlessness, let me know, okay? So, I'm gonna rub my hands together. been feeling some anxiety. That's consistent. We have a chakra in our abdomen, which is responsible for a feeling of confidence. Do just a little bit of energy plucking, okay? And then what I'd like to do is have you lie back on the table, and we're going to do a little bit of abdominal massage to try and ease some of that abdominal tension, alright? Okay. Excuse my partial snore there. I'm going to lie you back, okay? Okay. Are you okay laying down like that? Alright. Your back's not irritated or anything? Okay. Good. I'm going to put on a new pair of gloves. And then I have this amethyst here, and amethyst, I don't know why I can't say it right now. Amethyst is a very crystal in terms of ground. And this one is mostly a more raw form. So I'm going to place this right here. And that's going to help ground us, okay? So I'm going to begin. If at any point you feel any kind of surge of anxiety or discomfort, let me know, okay? I'm going to start by moving in a clockwise direction. That's okay. While I'm doing this, I want you to focus on your breath. With each exhale, you're allowing tension to be released. Letting go of things that don't serve you. Try to clear your mind. If you have thoughts that bust their way in, that's okay. Just awareness to your breathing. Each inhale, filling your belly, bringing awareness and attention and love to these areas, inflammation, tension, the root of the physical stress. Just let it go. Right now I'm working around your liver just lightly. I want you to focus your breathing right here where you feel my hand. Focus your energy, your awareness, and then exhale and release. Move back to the other side here. I want you to know that you are safe. You are cared for. And even if life feels like it's out of your control, you are always okay. As long as you are able to take a breath, able to move your body intentionally. You're okay. beyond our control. That can be really overwhelming and scary, and that's why it's important to have these mindful moments so that you can bring yourself back to the present, to your immediate space. You can always pick your stress back up. It can be there waiting for you if you want it. Sometimes we get so used to it, it's difficult to let go. Relaxation can bring a sort of emptiness because we're so used to our minds buzzing and that anxiety taking space. But it's okay to set it down. You can always pick it back up. Should you choose. And I know that people don't intentionally have anxiety. It's just about purposeful thinking, mindfulness about it. It can help us to allow ourselves to release it and let go. And just put some pressure here. In different areas. How are you feeling? More relaxed? Good. I'm going to take my gloves off and do a quick repeat scan. want you to just take a deep breath in, focusing on breathing into your abdomen. And breathe out a nice big releasing exhale. And again, deep breath in. And exhale. Good. Alright. You can let go of the awareness on your breathing. Allow your breath to become more shallow, less intentional. And taking your time, let's have you sit back up, okay? Nice and slow. Okay. How do you feel? Okay. Good. So, a couple notes here real quick. Alright. So, every day, at some point, even if it's just for a couple minutes, I want you to practice that breath work and just having a few moments of mindfulness every day. It can be especially ideal in the morning and also right before bed, allowing yourself to sort of have a relaxation ritual before falling asleep can be really helpful. Especially because a lot of people experience some sleep anxiety. The idea that we might not be able to fall asleep can actually worsen the ability to drift off to sleep. That being said, I also want to recommend some supplements and herbs to you that I feel will really benefit you, particularly in regards to your liver. So, the first one is milk thistle, which has, that's a commonly known one, huh? And it works really well with turmeric, which is a great anti-inflammatory. We encourage people to look for liposomal turmeric, which is more bioavailable once you ingest it. It's a lot better than the supplements that they sell. Those usually have less actual active properties. So then we also recommend using a supplement of actual beef liver, which I know that sounds very strange, but different organs that require certain vitamins and minerals to perform optimally are usually very rich in those minerals, which is why we recommend actually using beef liver as a supplement. You can get some from the butcher, or there are actual capsules of dehydrated liver, and they're very rich in nutrients, particularly B12, iron, zinc, and all of those contribute to much better liver health in a format that our body has an easier time recognizing than, say, a synthetic vitamin. And then I also recommend oysters as well, and those can be dehydrated as well. You don't have to go out and eat oysters. Some people don't like the texture. It can be a little bit of a sensory nightmare. And those are really high in zinc and can really help with getting energy throughout the day. In terms of your motility, constipation, I would like you to use some cascara bark. It's a very, very gentle, I don't want to say laxative, but it's like a relative of that family. And you just take some every day with a meal, and it really does help you to stay regular. And then in terms of just overall stress and relaxation, I recommend some licorice, which you can get in tea form, and it's sort of a light relaxant. If you feel like you need something stronger, we can also try some valerian root, okay? Yeah, we have all of those things out front in our lobby, so feel free to peruse on your way out, okay? Just writing a note to the front desk so they know which supplements to show you. Yeah, that is true about valerian root. It does kind of have sort of a sweaty socks smell, which can be a little bit off-putting, but it is very effective in terms of relaxation and helping people drift off to sleep. Okay. So, do you have any questions for me? Okay. Well, always feel free to give me a call. I'm going to be checking in with you in a couple weeks to see how you're doing and seeing if those supplements and the breath work are helping at all. And I also definitely encourage you to keep practicing that mindfulness morning and night, and also potentially finding a massage therapist to help if you continue to have the abdominal issues, alright? Okay. It was really nice to meet you. Thank